Hi, Dr. Heather Rogers here, and today we're going to talk about lasering. So I want to talk about all the different types of resurfacing that you can do for your skin. Resurfacing is a medical term which we use to describe a laser that promotes cell turnover. The most gentle of the resurfacing lasers is something called the Clear and Brilliant, and that is a brand name for a gentle laser that really only injures about 5% of your skin. That has two different hand pieces, and so there's two different wavelengths that the laser can be. It's a 1927 or a 1440, but what matters is that it drills little holes into your skin, and that sort of promotes cell turnover. So even though it only injures about 5% of your skin, all of your skin will then turn over in the coming week, and 1 to 2 weeks afterwards you will just have beautiful glowy skin. Clear and Brilliant is sort of my entry-level lasering. It's something that's really popular with people in their late 20s to early 30s. It's something I also recommend for individuals with melasma. Melasma is pigmentation or brown that happens on the face of women, usually after you've been pregnant or on the birth control pill, and people with light skin or dark skin can get it. And Clear and Brilliant is safe for all different types of skin. The trick is you just need to not be aggressive with it. It will promote cell turnover and lighten that brown. Because it is such a gentle laser, oftentimes people like to do multiple of them. Sometimes people do 2 a year. If you read about it, they recommend doing 6 a year. Very rarely do my patients need 6, but people really like it and they like the results and how good their skin looks. And so it is something that can get addictive. So that's the most gentle laser, and that's the Clear and Brilliant. The next laser that can be used for resurfacing is the Fraxel laser. That's the brand name, and its wavelength is a 1550. There also are other fractionated lasers like the Icon, which is a 1540, but the wavelength is similar to that of the Clear and Brilliant. The difference is there's a lot more energy behind it, and you end up damaging a little bit more of the skin. So with more energy behind it, you're going to have more puffiness and more downtime. It also means that the holes that are drilled into the skin are going to go deeper, and also you can turn it up so a larger percentage of the skin is then injured. And that's a good thing when it's controlled injury, because if more of the skin is injured, then more of it is promoted to turn over. All of this is very controlled injury, and for every little spot that's injured, the majority of the skin around it is not injured, which allows you to heal without scarring. So Clear and Brilliant, we're talking about 5% of the skin being injured. With Fraxel or the Icon 1540, is going to be controlled by your physician, but it can be anywhere from 10 to 30% of the skin is being injured. But the wavelength is the same as the Clear and Brilliant. And then the most aggressive form of lasering is ablative resurfacing, and this is the erbium or the CO2 laser. And here the wavelengths are longer with both the erbium, and actually the longest with the CO2, and they have significantly more energy. And so even though you are not necessarily damaging more of the total amount of skin, because there is more energy being put into the skin, there is more, the energy goes deeper into the skin, and there is more turnover, not only in the epidermis, but also in the dermis of the skin. That stimulates the building of collagen and even elastin. So the deeper, stronger lasers, which is the erbium and the CO2, those are the ones we use for individuals who really want to fight large pores, who want to fight deeper wrinkles, texture changes. Those have the longest downtime. So after you do an erbium or a CO2 laser, you really do need to go into hiding for at least 4 days. Your eyes are going to be puffy, and your face is going to be red for about a month. With the Fraxel, same thing, or the 1540, you will need to hide for sort of 3 to 4 days, but you're not going to have as much redness or as much puffiness. And with the Clear and Brilliant, the most gentle of the options, that one you might be red and sort of a little bit tender for 4 or 5 hours, and then your skin will feel dry thereafter, but the recovery is really quite easy. So it's important to know when you go and see your provider to talk about these different options for resurfacing. What's the endpoint? Where are we trying to get you? How much downtime can you tolerate? And then also, what's the risk of complications? If you have darker skin, the higher energy, or darker skin, or just an increased risk of creating pigmentation, the higher energy resurfacing lasers might be just too risky for you. And that's about it. So if you have any questions about that, just DM us or just ask us in the notes, in the comments, and let me know how I can help.